Hi, my name is Anastasia Tobin. I'm a 2015 AMS Fellow, and the project that I'm working on is called Exploring End-of-Life Processes in the Emergency Department. And I come to this project with three different distinct experiences. I'm a former dietitian with experience in the hospital and community sector. I'm primarily an academic. I'm a sociologist, and I am interested expressly in how people experience illness from a social perspective. And I am also a caregiver, and I've provided care to my mother particularly, who faced the end of her life when she was diagnosed with brain cancer. All of these experiences led me to become interested in how care occurs in the emergency department for people who are facing the end of their lives. And I think this is a particularly interesting place to look at this because patients are often really scared going into the emergency department. They fear further interventions when they're already quite sick. They're scared of more suffering, more pain, and a lot are scared of dying in hospital. Really, the emergency department is the perfect place to provide compassion for people who are facing the end of their lives and who may not be able to get that care in their homes, despite the fact that that may be something that they want. So my project is actually observing and following both healthcare providers, the patients that they're serving, as well as their caregivers, to see how the process of end-of-life care occurs within the emergency medicine department. And my hope with this project is that from each perspective, from the patient perspective, from the caregiver perspective, and from the healthcare provider perspective, to try to understand how this process could be better supported. How can we find those moments of compassion that we can build on, that we can use as teachable moments for other emergency departments, to understand where those more difficult moments are, when patients may need more support or other things. And how we can support our healthcare system and providers in that system to provide this kind of care where they themselves are not feeling anxious about that kind of care, and they can feel good about what they do and providing the best support that they can for the people that seek help from them.